Good afternoon. How are you guys? Tired? No? Not yet. We have more parties to go, right? Remember, this is a Google event. We like to party. My name is Evren. I just noticed the spelling. My mom would kill me, but that's okay. I am here with my friend Mike, who will introduce himself. We'll talk about Chrome Enterprise and how it is helping the healthcare industries. And we'll make it as interactive as possible. So we want you to ask questions. We have a lot of time in hands, a lot of content as well. But if we make it exciting, it's really good for us. So I used to be the senior VP and CTO of GE Healthcare. So I learned the healthcare the hard way with all the traditional EMRs and traditional PACSs and revenue cycle systems, pharmas and labs and so forth. How many are from providers? Any providers in here? All right. How about lab systems and PACS and so forth? Awesome. Insurance companies? Any? Ooh. So, revenue cycle or just a true? Okay, awesome. All of them. Nice. We should talk. So my friend in here, Mike, why don't you come here and introduce yourself?
Hi, I'm Mike Romatzik, work for Middlesex Hospital. I'm a desktop architect and deploy a lot of their virtualized endpoint solutions. One of which has really changed kind of how we're viewing technology in healthcare.
Yeah.
And really excited to talk about it today.
So Mike has joined our events several times. This is not the first thing and thing that Mike is doing. He was with us at HIMSS as well, did a fantastic job. So we keep pulling him in, and his company sends him over here. So we love it. Thanks for coming in here.
Thank you.
What I thought we would do is maybe we can play this, and maybe you guys can watch it a little bit.
In business, there are a lot of moving parts. Google Cloud helps you connect the dots. Use Chromebooks with G Suite to make communication more open and productive. Access real-time data from Google Cloud Platform. Keep inventory up to date automatically. Add smart chips to your valuable products to monitor location and conditions in real time. Get instant updates from deskless workers out in the field. Reduce costs, improve efficiency, and ensure security with remote device management. Streamline operations and stay in control with connected tools and services from Google Cloud.
So the reason I wanted to actually have this conversation and I wanted to do it myself, when I first joined Google and I really got deeper into how Chrome was operating, what Chromebook meant and OS meant, and then I said, guys, this is really designed for healthcare industry. So those of you who are in hospital world, there is always a desk where the nurses come to, the doctors come to, in specialty departments, in entrances, whatever it is, and they always have to switch out their user accounts. They always complain. Remember, I was their CTO, so I actually got a lot of those complaints. They would say, we can't operate effectively. And effectively is really important. Why? They wanted to have access anywhere in their environments, not just in that particular department or on that particular computer. Wherever they are, they want to really serve their patients and do it in the right way. And they wanted to also get this something called cost. I think healthcare is pretty costly. Last time I heard is over 3 trillion. That's a big number. It's a big number. And they have data, right? I just heard this morning, we're in the 10th year of the meaningful use, meaning we're trying to digitize the healthcare data, but we're still not able to get enough insights from that data. It's all over the place. And who in the world of healthcare doesn't worry about security and privacy? So when it all comes together, it's like, wow, this is a great platform for us to really take advantage of it in the world of healthcare. That's how it all started. Take a look at this. The number one concern, right? cost. We talked about it. This is costing trillions. That means as a patient, we're also paying for it too. It's their number one worry. And they go through it. Who wasn't hacked, I wonder, in the world of healthcare? They just don't know it. If you remember the Patch Tuesdays, so those are any CIOs in the room? Nice. You know the Patch Tuesday, right? Somebody will send you a patch. Oh, come on, Microsoft does a really good job of doing that. They will send you a patch. They'll break everything for you. And then your customers will call you, hey, this is not working anymore. And all of those things are part of security. I want actually Mike to really highlight some of that thing for you guys, how we're doing it. But this is a real number, guys. 233. And if you ask me, just in the healthcare, it's a lower end of the spectrum. But we like to talk about the whatever it is, the lowest number, not the scary numbers. Now, everybody wants to change their margins, make it much more profitable, so that they can actually provide better care for their patients and through their institutions. But to achieve this, they also want to improve the patient experience. You can't just focus on the bottom line. You really have to focus on the patient experience as well. That's an important thing for us. But the other thing that we keep hearing is, hey, we have data. Now, you heard, who hasn't heard this morning, right, all about AI, we're delivering lots of AI solutions. Now, people can do AI if they have the right set of data. If you don't have a data really strategy, if you don't really have that infrastructure already in place, doing AI on top of a health data is not an easy task. And studies show very hard for a lot of the institutions to really achieve that. Now, I have been a cloud evangelist for years. Many, many years ago, when I wanted to talk to the CIOs about why cloud matters in healthcare, nobody wanted to talk to me. They actually ran away from me. Years later, well, here we are, right? Many, many people are coming in here. And actually, I was in a panel upstairs about an hour ago. CIOs there were telling us, not doing it on the cloud is going to be really hard for industries, especially for healthcare industry. Because they're worrying about cost. Well, cloud helps you with that. In the world of healthcare, we talk about universal access. Well, cloud helps you with that. And they want real-time updates and access to their information. Cloud helps you with that. That flexibility. There's not a provider, radiologists, pathologists, cardiologists, general doctors, nurses, where they don't have a desire to access their information wherever they are, so they can actually help their patients. This is how the infrastructure works. Now, to achieve this, to serve the industry of healthcare and life sciences, we in Google have set out a few years ago to build this platform, the Google Cloud for Healthcare, to really build it on this massively scalable platform that we have. And on top of it, we built necessary hooks, necessary regulatory applications, all the HIPAA compliances and whatever that you needed, but to make it easy for people to really access data, do something with it. We don't know much about how insurance companies operate. We don't know much about how healthcare companies, their hospitals operate, but they know. They can actually build their solutions on top of this platform. This is exactly what we're set out in Google Cloud to really help accelerate getting to the bottom of what healthcare industry needs. And that's what excites us. That's where we're going. Along the way, all these tools, all these proven tools are available for the healthcare industries. And we'll talk some of that. And today, you've seen the term cloud workers. All of us in here are cloud workers. So some of you have your phones where you're probably tweeting or talking to somebody who's somehow connected through cloud. This is a savvy group. Well, the next generation who are coming in, my kid is in middle school, he already knows how these tools are operating. They're already coming from the schools, very knowledgeable about how G Suite operates, how Chromebook operates. I remember 5 years ago, he was pushing me, hey, you're kind of thinking the old way. You got to change this. This is my young kid. He is coming to me and telling me how they're building, using TensorFlow, new AI models in middle school. This is your new cloud worker coming in. And this cannot be achieved with the legacy systems. And Mike is going to come and tell you guys how it's not happening, how it's not working in here. Let's start with the Chrome Enterprise, Mike. So how did this help for you guys? Why don't you tell us your secure endpoint stories?
Well, I mean, this is a lot to digest. I mean, you're in IT, you're tasked with reducing costs, making the experience better, and yet you still are subject to the requirements of regulatory commissions in healthcare and requirements placed upon you by your vendors. A lot of hospitals and healthcare organizations don't feel they really have a choice. And that's what is so huge about a product and a platform like this. We get a choice. We get to find a new way to do business. We get to find new workflows and really go back to square one and identify what it takes for somebody to be productive. About not just moving a workflow onto a new platform and making the same mistakes just on a new piece of hardware. This is starting from scratch and realizing maybe 30 to 40% of your employees need 2 to 3 apps, some of which are already HTML5 or web-based to be productive. Why do you need the overhead of an operating system designed with the wrong layer at the bottom? Yeah. You know, conventional PCs have their security, encryption software, antivirus, additional policies at the top. Chrome is built on the security principle of having an encrypted, easily updated, and hardened device that can be easily controlled, cloud updated wherever you are, and done in a way that really turns this process of getting work done into picking up a tool and being productive immediately.
That's good. So security is core of everything. We talk about security everywhere. So if you haven't heard enough of the security, you got to go from end to end. We talk about multi-layered. So you heard this morning from Earth, even in our servers, every hardware that we make, we have a special chip, Titan chip. It actually, at the root of it, recognizes whether or not the software and hardware was made by Google. If it is not, it's as good as an ashtray. It doesn't do anything, it's a brick. It just sits there. That's how we prevent. That's why every one of us, we look at every one of our laptops, I actually have to touch to make sure that computer recognizes my touch, so we prevent phishing. So there's 85,000 Google employees, and I just saw an article actually yesterday. It says we don't see phishing in the Google employees world because it is designed for us. And how did you guys take advantage of this?
Honestly, it was a very simple pilot initially because at the point we got into it, it wasn't largely understood how we could apply Chrome to healthcare. And we tried out small bits here and there and realized the use cases were just snowballing. Yeah. It became very easy to identify either simple ways with user or public-based sessions to knock out use cases that constantly had calls to your support center, that constantly had to have remedial action or be rebuilt, or in some cases were subject to damage where several Chromebook solutions are actually more robust physically, not just on the software side.
So ever since you have actually moved to Chrome-based solutions, you've seen a lot of reduction in your kind of the malwares, whatever is coming through your system.
Well, and frankly, this initial part, we didn't have a team set aside. A lot of people think it takes a lot of overhead to get started in this. I wasn't the Google person. I'm still not. I handle the virtualization and a lot of system design. The first 300 books we put out, I put out myself. It took minimal side effort to identify, build, and deploy the books, and then I was giving out my cell phone. People didn't believe that these were going to be successful initially. And it was amazing how quickly they took hold and how quickly people were contacting, trying to find out what else they can do. You know, where else can they be productive? Can we get 4 or 5 more? And they were starting to trade in devices without being forced. These were, you know, a rapid uptake by the user, not by administrative push.
Thank you. We get a lot of questions around the sort of how do you manage the licenses and so forth. So if you look at it from your perspective, because you manage it, you distribute it, what are the things that you've done? What do you like about working on the Chrome Enterprise world?
Well, the power of the admin console really comes down to driving policies through the OU management and delivering your Wi-Fi policies, your security policies, and app experiences. We have very basic layouts where you know organization-wide, if you're in healthcare, you can't get some things out of virtualization. They're just not natively supported yet. So we have our Citrix deployment, our Chrome Remote Desktop deployment, everything is built into the OUs. Within a few minutes of pulling the device out of the box, you have an accurately deployed, immediately usable device that you don't have hours of setup on, and you don't have the variance. Even by your veteran employees deploying conventional PCs, there's always variance, an app that didn't get installed, something that didn't get configured. Bare bones device is going to go out every time accurately as long as you drop it in the right unit.
So you provided the right flexibility, those cloud workers who are desiring it, and reduce the operating cost for your company that's desiring it. So user experience and patient experience is all going up. That's pretty good. How about the devices? I know you guys are using a lot of Chromebook, and what is your favorites? I love the fact that actually we're giving a lot of these devices to education system. But tell me about your experience.
Honestly, we tried a little everything. I mean, I want to say we went through like 6 different form factors. Bases, books, box, bits, you name it, we tried it. And the primarily, our cloud workers were very successful, with your base $200 to $300 device. But the real surprises came when we got into the rugged scenarios. So you look at your EMS workers, the fleet that's normally just a whole bunch of tough books, $3,000 bricks that never come back, always fall off the domain, always having security issues, still getting damaged despite being ruggedized. And we took a risk and we replaced them with Education Edition Chromebooks. $250 Chromebooks, taking out a $3,000 to $3,500 device. This was a year ago. They've been completely replaced for all of our ambulances on the cost of one of their annual replacement Toughbooks. They have net to actually break one. The only one that came back just needed a soft restart. They've been amazingly durable, and frankly, the productivity is incredible. They're in really stressful, demanding situations, and they're able to grab a tool, it comes up in a public session, immediately to what the content they need, and when they're done, they toss it in the back.
Right.
There is no concern about getting the 5 or 10 minutes up or possibly having a call to access or to push a patient into another facility. Yeah. It's just a tool that they use as part of their kit.
The access, the speed, the flexibility, and you lower the cost again. That's awesome. That's awesome. So, we're talking about these things, but I'm hoping you're making the connections with about the staff, about the operations, about the experience. So end to end is the focus, and we're doing it in a very seamless way. Whether it's your mobile device that you're using, or the Chromebook that you're using in the operating room, whatever it is that it's deployed. Anything that you want to add in here, and how your users are benefiting from this?
Yeah, the connected staff was a big one, particularly when you have your on-call providers. You have a doctor, their time is precious, they want a device sitting at home. That device sometimes doesn't get used for a long period of time. Yeah. It's off the domain, it's a support call, it's a VPN issue, it's an encryption issue. We started swapping them out with Chromebooks. You would have a provider that would open up that book cold from a call at 2 in the morning, and within 20 seconds, it would boot, they'd log in and have access to the patient record via 2-factor. It was extremely secure, it was reliable, and they grew to depend on it to where, again, another voluntary process. Even them telling their colleagues, the PCs just started flooding in and dropping on the counter, and we just had a stack of books ready to go out. I didn't even know until they asked for another dozen books to get ready for it. Yeah. It was just an incredible turnover that, again, was the user was driving the need and the interest to really make their process better.
Yeah, what I'm hearing is your healthcare professionals want to do their job, and they don't want the PCs and technology to be in the way. So with Chrome Enterprise, you actually enable them to do their job much faster and easier. Fantastic to hear. So how did this help? Because in the end, healthcare professionals want to spend more time with their patients. Now, one statistic is a doctor has about 6 minutes. If you go to a doctor, what do? You're sitting in the room by yourself for a while. I was just in my doctor's office, sat there, and he didn't show up. And a nurse came, asked the question that they already knew. I think she was just killing some time. And the doctor came, and I literally did this. And he knows. It's like, hey, you're in the healthcare, right? I said, yeah, I am. What are you doing? I'm timing you. See how much time you're going to give me. 5.5 minutes. I said, hey, you're rubbing me 30 minutes, 30 seconds. Because I knew the average is 6 minutes for doctors. And they won't actually do more. But the poor guy, he has to go fill out all the other, now not everybody is using Chrome, right? So how did this help you guys?
So the first couple points actually tied together incredibly well. When you start looking at particularly a hospital and inpatient care, and you have a conventional model that has the big carts. You probably all have seen them in the hospitals. They love showing these bright new 200-pound carts that a 110-pound nurse is going to wheel around to try and help you. They're going to open up your patient record, hopefully in time. They're going to wheel this monster in, and they're going to try and look at you to the side, or they're going to have their back to you. And on top of a $4,000 to $5,000 cart, your patient experience is suffering. They're paying attention to this monolithic tool instead of interacting and having something much more effective to work with. Switching a lot of the inpatient, and the surprising part was how quickly it got picked up on the outpatient side. When they were rooming patients and constantly jumping between records, they started demanding the books once they found out that they were starting to be used on the inpatient side. It was an incredible change where you looked at much fewer pieces of heavy equipment that we could afford on the budgets for the given areas versus having banks of Chromebooks at common care areas that the nurses could just pick up, that weren't assigned to them, that had nothing pre-deployed, that was just a kiosk device. And they can grab a $200 device and get to work, work with their patients, sit with them, show them the chart, show them what they're working on, actually involve them in making an interaction rather than an interview.
Yeah, you nailed it. I mean, I was late in forwarding this slide, but that within seconds, being able to interact with their patients is the key. Because everybody wants that. Otherwise, they're going to keep going in there and so forth. Now, there are scribers that go along with the doctor too. They have to actually do certain things to really interact with the doctors and the medical records and so forth. We are building technologies to make that easier as well, along with it. So it's a very, very, I'm hoping you guys are able to see there's a little of a circle in here. But there's a lot of, we talked about cost saving. There's a lot of saving that comes with Chrome Enterprise, not just for the healthcare industry, but many others. But healthcare is our favorite topic, so we're talking about this. Anything you want to add in here, because you live this. This is your world.
Yeah, well, the beautiful part on the Chrome side was you didn't have to even work at justifying the cost. Once we established the use case and we started showing what the low-hanging fruit were for getting the adoption rate, and these are great numbers. They're very good overall on an industry. They're incredibly conservative. Some of the initial use cases we looked at are a ridiculous number that really is difficult to believe, but when you were looking at the requirements initially were the full laptop sitting on a cart, not even the full med cart, and you were looking at $3,000 to $3,500 for, again, something that you had to image, load, build, strap to a cart, wheel around, and then maintain and deal with physical damage. And you change that out to a $200 Chromebook. You're looking, some of these cases, from 12 or 15 to 1 cost reduction. And the life cycles are comparable. You're not looking at something that's thrown out in 6 months. They're holding up for the 2 or 3 years between replacement on the standard warranty cycles. Wow. The devices that people said, oh, well, that's just an education tool, or that's just for that. This has been going on in our organization for over 2 years now. We've been living it, we've been pushing it out, and we've been driving through a lot of some of the parts of the industry that said that won't work. And guess what? It's working, it's expanding, and it's being driven by our users, and it's being driven by every part of, even including our security team, which frankly doesn't agree with anybody. There's nothing you could just suggest and security goes, great, go for it. So the fact that this is getting them out the gate and saying, oh yeah, yep, have fun. It really opens the floodgates to the possibilities.
That's a good sign of confidence, right there. So your numbers are much bigger in terms of savings in here, and I know we had to be more conservative with our numbers, but I like your numbers. Share them with everybody. So one other thing, if you look at the surveys, and just about every C-suite member of healthcare will come and tell you they lose 40% of their new employees within the year. And there's a reason for it. A, they are trained to do certain things to provide health care to their patients, yet lots of things are in their way. And technology, the tools, are one of them. And what we have seen is the impact, the positive impact that Chrome Enterprise solutions had. So anything you want to share in here? I'm sure you're living this thing every day.
Yeah, so one of the first groups we approached when we first started rolling out was our education department. Finding the ones that not just worked in healthcare the whole time, but also worked as teachers and prior educators to understand that really when someone first steps in the door as a new employee, there's a lot to take in. There's a lot to learn. There's a lot about your EMR, or in our case, up to 4 EMRs that they're learning between different business groups. And getting over that first hump of, well, do I have to learn this computer system now as well? Chrome, being so successful in the classroom, has really driven us to match that success in the professional classroom as well. When you're onboarding employees, and the first thing they see is a Chromebook with a very familiar layout, that's like one less thing that they have to deal with. There are so many other regulatory items that they have to keep track of and understand hospital policy. This is just a tool that people are able to easily adapt to and help each other. Okay. And every year, it's more relevant. Every year, more and more people come out of school and have encountered them at home or through other interactions where this device is becoming commonplace, and they're just learning that it also has business use that far exceeds their expectations. So making people comfortable with the tools that they get to use in their workplace, it allows them to provide better care and to interact more with their patients.
You get to keep more of your starters in the company so they don't actually leave right away within the first year?
It's always the goal. Every employee is an investment. Why are we going to give them an inferior tool? It's a bad investment. We're going to spend all that money and all that time to train on board just to give them something that's going to cause them headache. It's going to take them away from their job. This needs to be a valuable, reliable, and fast tool.
So before you actually used Chrome-based solutions, how was your security approach and how is it now? What are you doing differently?
Well, so I came on when we had already become a G Suite customer, but we were still in a conventional PC model.
Okay.
So the security layers followed that big ugly pillar of load Windows, load encryption, load antivirus, load policies, apps, everything else. And every layer had a potential loophole. Every layer had something that can go wrong, and even if there was a policy for how it should be done, it doesn't mean it was done even correctly by your veteran employees. There was always an opportunity for variance. So enter the Chrome side of things where we could have a 20-minute meeting about the dozen or so policies that we're going to apply to a new business unit. That's gospel at that point. That's how those devices are going to go out. That's how they're going to be maintained. And in the event of a device being stolen, which is also far less likely given there's no content on them, we can provide, and we have had to provide when a public device was stolen, and we provided the sheet for the OU information to security and the auditor that showed it was set to log off, wipe the content, it had no download available, USB ports were turned off, and the device was, significantly, reduced in liability versus any Windows PC that anyone's logged into. You have an encrypted device. It doesn't matter if multiple users even logged onto it. Each profile is obscure to the other.
Yeah.
You don't risk a sideways attack by exploiting one user that was careless.
Yeah. This is awesome to hear. Great to hear. So in the end, you deliver care, and how your patients see you, value you, or give you feedback matters. So anything that you want to share with the team in here?
Yeah, all the way down to the patient feedback. Frankly, we're all driven on metrics for performance, for continued budget and investment, and our patient safety and the care they're provided is extremely valuable, and it drives, what we're trying to serve. We are trying to serve our communities and drive better patient care. And providing a tool that makes that care more interactive and more effective and makes that data more accessible to the doctor that's 3 states away at a partner hospital, or the night call, or the day of, or in an emergency situation. Their record's accessible. It's reliably accessible. And it's a huge difference in that interaction and how patients feel. They're not just a byproduct of the process. The process revolves around them.
And if you look at the generations coming in now, they're all very savvy, digitally savvy. They want that. They want to be able to have that access. Now you actually have the means to do it. So it's all about the outcomes, right? For the teams, for the patient, to the business. Any final thoughts in here before we go on to some of the other things you guys have achieved?
Well, it really, it looks like 3 different pieces, but it really is one picture. And that's the simplicity in this.
Yeah.
You're looking at one style of delivering content, of doing it securely and doing it reliably. And it really wraps it into just a consistent picture finally that's not, a certain style or deployment for this or for that. It's a cohesive platform that serves to, really
It's a true way of transforming. So people talk about digital transformation. That's what this is all about. So if one approaches it, hey, I'm going to replace this device with this device, or this operating system with this operating system, in my opinion, that's the wrong way of starting. If you really want to transform how you're doing business, if you want to leapfrog and kind of start in the next generation of thinking, this is where clouds, this is where Chrome and enterprise solutions that we provide come to play. That's one thing that I wanted to add in here. So this is your world. I mean, you provide from hospitals to inpatient to outpatients. Anything you want to highlight in here, and how you're making it better for the healthcare?
This really defines where we've expanded into. Like all the organizations, you make additional acquisitions, you take on additional software requirements and additional liabilities based on those use cases you absorbed. And currently, this is just a portion of what we service. And this is finally a platform that can achieve those goals. And a lot of it, the beautiful part of it, is even the older applications, the applications they said would never run on anything but what they're required. The partnerships with virtualization, with Citrix, have allowed us to deliver those experiences to a modern platform. And even some of the other partners that can take that old database that they say they require access to and put a new HTML5 front-end wrapper on it. Why can't that be a cloud-based service? Yeah. It doesn't matter that it has old code and an old interface. Data is data. We can drive it, we can deploy it, and we can access it through a more modern, more secure, and more readily accessible platform.
Absolutely. Thank you for that. So, I know you've been using G Suite. You've been a big believer of the Chrome enterprise solutions. Any words in here? I think you hit all of them, but I just wanted to make sure you had a chance.
Yeah, so, we have a lot of, multiple use cases on here, but one of the parts that has really started to stand out is when you're looking at public sessions. Now, public sessions for training, it's a great start. It gets people accustomed to it.
Yeah.
Public sessions are incredibly powerful. It really, the simplicity is in finding out the base aspect of what people need to do. When you're looking at your raw requirements of the 2, 3, 4 apps that everyone might need access to, and you could deploy those through the admin console and give users a base experience, and also your partners and visiting members of the hospital that might not have Active Directory accounts, but they do have access to one of the EMRs or one of the other systems. It used to be you had to spin up another account for them, provide a laptop, get all this set up. Having a bank of devices that you can just grab a device, fire up, they'd have access via Citrix storefront to the EMR or to another resource they might have access to. They can elevate as needed, but most of the part is not required by all employees. So you can really drive a lot of varied experience without the risk or the heavier deployment of user-based sessions.
Yeah. I know you said this, we love public sessions. Maybe you might want to kind of expand on, you want some water? On the public sessions.
Yeah, and again, that EMS thing, I got to go back to that for a second. That EMS part changed what we do in the state. We have workers that work all over, not just our county, but beyond with shared hospital experiences. They're pushing it at other hospitals. We haven't even spoken to the other IT organizations, and some of the other hospitals have been reaching out at how much time it saved them and how much more reliable those solutions have been for them. And it's pennies on the dollar compared to their current investments. It's just an amazing overhaul of their entire solution with what turned out to be maybe 20 minutes of effort of talking to them and interacting with these people. And really, all of these use cases, all of the areas that we've identified throughout the organization, it doesn't start with a top-down, we're going to push this technology. It goes with involving the end users and learning what they do and evaluating and creating a hybridized solution and giving their input. Because frankly, when you push a device on someone and say, this is how your department's going to work, and they had no input on it, they'll still get their job done. The likelihood of additional support calls are going to go up. You're going to have other various issues because of short-sightedness. The Chrome process is so immediate in the ability to provide feedback into a deliverable solution. I got a call this week while I was at the show, and I adjusted one of the OUs on my phone. This is something even from the Wi-Fi here. It did not take a lot of time. It updated within 30 seconds, and it saved our lab an absolute nightmare because they had an on-site inspection that came up out of nowhere. So we deployed 20 books with an adjusted OU for a kiosk mode.
Okay.
And they got deployed out
Wow.
yesterday morning,
That's
about an hour after I got off my plane.
That's awesome.
This is such a dynamic, non-time intensive solution. You can really just shift on the fly, deliver what's required of the business unit, and evolve from there.
That's fantastic. That's fantastic. So we've been talking about Chrome Enterprise and how we are trying to help fix the problems of the legacy systems. I don't want to dwell too much on it, but I hope all of you heard some nuggets and some information in here, because we do want to get to a point where we can actually hear some questions from you guys. And this is one of my favorites. You're the hero behind it. You made this thing happen, and thank you. And anything you want to add to your own quote?
Obviously licensing costs are massive for all our organizations. Everything from your database licensing to CALs for everything. And when you're looking at not just a reduction in costs, but an increase in reliability and frankly, the scalability and the collaboration that's allowed by these products, it's not something people are used to before. When you have a quick chat that turns into a public document and you see a dozen cursors moving around a sheet, you realize that this product was really built with collaboration and efficiency and productivity in mind.
Yeah, that digital connectivity, that experience, the collaboration is absolutely something. So we have come to the end. Thank you for those questions and for your time. Lots of content to cover tomorrow and Thursday. But I wanted to personally thank you for coming in here and taking your time. We appreciate it. We're around if you have questions, and you can ping us too. Bye.
Absolutely. Thank you, everybody.